Hello everybody and welcome to this lecture on the microcytic anemias. So this is meant to be an overview of the microcytic anemias. This is a slide I include in all my anemia lectures, just the basics of anemia, which is a deficiency of RBCs, red blood cells, or it actually could be a deficiency in hemoglobin. The definition allows for both. On the right here is a general idea of what the values are for high and low of hemoglobin and RBCs, but always check with your lab because each lab kind of has different reference ranges. And of course, if you're taking an exam, use the exam reference ranges. But generally speaking, this is where they're at, especially with the hemoglobin. And the big thing to note here is that it's different for male and females. Males have a higher hemoglobin requirement generally than females, for the normals at least. And your symptoms of any sort of anemia, whether it's micro, normo, or macrocytic, is you're going to initially have some fatigue, might be a little dizzy and lightheaded. As it starts to get a little more severe, you'll start to see it in the skin in the form of pallor, and in its most severe form, you'll start actually seeing shortness of breath due to that decreased ability to hold on to oxygen in the blood because you have less hemoglobin. First step in diagnosing any anemia is looking at the MCV, or the mean corpuscular volume. And that simply is exactly what it sounds like. It's the volume of the corpuscle, which is the RBC. And so we can see the general values that I use is just normal is 100, or 80 to 100 is normal MCV. So that'd be considered normocytic. And then microcytic less than 80, macrocytic over 100. If you were to go to UpToDate and look up anemia, this is the chart they use for helping you diagnose the type, and it uses the MCV. And this is the best way to go about it, in my opinion. And of course, with a microcytic anemia, we're going to be looking over here with an MCV of under 80. That's femtoliters is the unit, but MCV under 80. So this is the microcytic section that you should follow in general. I've cut that down over here to show just the microcytic section. We're not going to go exactly off this, but I'll just do a little touching here. The best way, in my opinion, to look or to think of microcytic anemias is that something in the RBC, the red blood cell, is either missing or altered. There's less of something in there to make it smaller. There's not as many components in there that would make it smaller. Alternatively, those components are all there, but they're altered such that the individual components are smaller, leading to a smaller RBC in total. That's the way I think of it. So if you're thinking of it that way, what is in hemoglobin? Well, it's in the word heme and globin. Heme is the iron portion. Remember, the iron connects to that protoporphyrin ring, and the iron is actually what carries the oxygen. So what can be missing or altered in the heme portion? Well, the obvious one is iron deficiency anemia. You have less iron, you're going to have less hemoglobin because you just cannot make it. And that's early stages of iron deficiency anemia will actually show up as a normocytic anemia most of the times. Once you've had iron deficiency anemia for a little while, and then in the later stages, it'll actually become microcytic. Because remember, you do have iron reserves, so initially your body's going to pull from those reserves, but once you've exhausted the reserves, you're going micro. The next is anemia of chronic disease, also known as anemia of inflammation. That's what this ACDAI stands for. And then lead poisoning will also cause a microcytic anemia, because lead poisoning is actually an inhibition of several of the enzymes in the heme synthesis. So that's why I have it listed under the heme here. And then on the other hand, the globin, well, there's a few things here, and that is all under the tree of the thalassemias. You can have alpha and beta thalassemias, and they're all of various degrees. That's all, and that's enough for another lecture. Really, that's a lot there. But thalassemia affects the globin side of things, and I have videos on iron deficiency and anemia of chronic disease out already, and lead is coming. So those are what you need to look for in microcytic anemias. And if we just close this out by looking at the chart, we've discussed iron deficiency, thalassemia, anemia of chronic disease. And another thing they note here is that you could have multiple things at the same time. And, iron deficiency is very common. It's the most common anemia, so you could have iron deficiency on top of other things. You can, and this just talks about the testing you do to actually diagnose this, and thalassemia here, which you'd use a hemoglobin electrophoresis really to diagnose. And this is all in the addition of clinical signs and symptoms. So this is an overview of the microcytic anemias. Thank you for watching.